Well, good afternoon to everybody. I'm Dan Parad, the president of St. Vincent for the Southern Region. It looks like something special is going on here this afternoon. It's pretty exciting. So I want to welcome you all to a very, very exciting day for us as we make a historic announcement about the clinical care here at St. Vincent. As is part of our culture, though, I'd like to ask that we start with a short reflection and prayer. And I'm going to ask Sister Jane McConnell, she is the Director of Mission Integration, to lead us in a short prayer. Sister Jane.
Thank you, Dan, and welcome everyone. It is our custom as a faith-based ministry to pray together for special events and in our meetings, acknowledging God's goodness, God's presence, God's care in our lives. And so please pray with me. Loving God, we thank you for your presence with us today as we celebrate this very special and exciting announcement of extended healthcare services for families and children in our tri-state community. We've been collaborating for many years as your special blessings upon this continued St. Vincent Peyton Manning Children's Hospital. The little children, for such as these belong the kingdom of heaven. And he welcomed them and embraced them and blessed them. Guide us, dear God, as we continue this ministry entrusted to us in our help us welcome and care for all children with gentleness and compassion. Amen.
Amen. Thank you so much, Sister Jane, for that beautiful prayer. You all with us today. Thank you so much for being here. You know, for years, St. Vincent Evansville and Peyton Manning Children's Hospital have been collaborating to care for the tri-state goal has been to continue to grow our relationship to share with you today. I know our community has been patiently waiting for this moment to hear this great news, and I am thrilled to share with you what I think you might have just heard from Sister Jane. In Evansville. Round of applause. That sounded so good, I just have to say it again. A second dedicated children's hospital right here in Evansville. So Peyton Manning Children's Hospital, Evansville, will offer children in our community local access world-class special guests. And on behalf of our board of directors, on behalf of our associates, on behalf of our community, I want to thank you and across the larger Ascension footprint. And Jonathan is going to talk a little bit more about what this partnership really means. Jonathan, thank
you. When I walked in, there was all this energy, and I wondered what was it about? And I know what it's about. It is, you all are here to see some very influential people. And I got excited too because I always love seeing our founders, the Daughters of Charity, here present with it. Yes. Because when you look at what they've done, yes. It is their shoulders that we are standing on. It is their mission that we've been entrusted with, and how do we carry out that mission. So to see a number of them here and to be able to spend a couple of minutes with them was my moment for the day with it, because it always grounds us in what ministry we have that we've been called to in this vocation. Before I talk about the significance of today and how far back it started, I'd like to also have a round of applause for all the individuals who not only prepared for today, but for these couple of years that we've been truly formulating what this partnership needed to look like and how did we advance this collaboration. So for all of you that had a hand in that, please, let's give them a round of applause. So I come to you today not in the long title that Dan has. I do get made fun of for having that incredibly long Ascension title, but it helps because people, they forget it pretty quickly. But I come to you today also as a parent of a child whose life experiences that I and our family and friends had through there further cements the incredible work that's being done and the partnership that we have with our physicians and our nurses and our child life specialists and everybody surrounded with that, and how do we care for those who are struggling. For over 140 years, Ascension St. Vincent has been caring for kids not just in Indiana but the surrounding states as well. And what you're seeing today is yet another advancement on that. We have more than 170 inpatient beds in Indianapolis, 23 pediatric intensive care unit beds, and the state's largest and most complex neonatal intensive care unit at level 4. These states. What we're doing today is not the start, it's the advancement of what has gone on between our physician and clinical colleagues in Evansville and Indianapolis for several years now. And so after today, or after we have that incredible ceremony of cutting the ribbon, take a minute to talk to some of the pediatric specialists that are here before you and ask them about the work that they have done for the last several years aligning clinical pathways and protocols, standards of care, communication, because the service you're getting today is a mere advancement on that. Because it's been in place in so many other forms, and now we've added one more piece to it. And if you look back at the history, over 140 years, it was back in 1998 that we had a number of pediatric subspecialists that came to the St. Vincent leadership at that time to talk about it is necessary for us to have pediatric care under one roof where we can truly advance what we're doing to care for kids. And as that was starting, as too was our relationship with an individual known around the world, and how he could make an impact and a mark on sick kids and sick individuals in Indiana and beyond. And in 2007, we cemented that. by adding him to the member of our senior leadership team. And he continues to be a member of our senior leadership team. And in retirement, even more a member of our senior leadership team. And so what we get is so much more than a name on the building. We get a strategic partner. We get an individual who's become so well educated and versed in what childhood care looks like and the impact that it does make, it should make, and it needs to make even further with it. And so with it, I am pleased to announce the best medicine we have in the formulary and a member of our senior leadership team, Peyton Manning.
Thank you, Jonathan. Hello, everyone. I was sent some bios of some of the people that were going to be here today in advance of this announcement, and it reminded me of this past March when I was invited to my 25-year high school reunion. And the school asked if you would email a little update about what you've been up to the last 25 years. And I was reading my fellow classmates' bios and resumes, very impressive, and for whatever reason, they all kept using the word field. I'm now in the law field, I'm in the investment field, I'm in the medical field. And I was thinking, what field have I been in? And what field am I in now? So after spending quite a long time, I finally came up with, after graduating from college, I spent a lengthy career in the physical education field. And now I'm in the healthcare field and the insurance field. And I've recently joined a band with Brad Paisley. That was my bio. Like Jonathan said, in 1998, I was drafted by the Indianapolis Colts. When you are the #1 pick in the draft, you are going to a team that has earned the #1 pick in the draft. It was a challenging year. I set the NFL rookie record for interceptions that year. It's really hard to do. 26. You got to throw 3 in your first game, 4 in your second game, 3 in your third game. If you get 10 early, you really have a chance to break it. That's a record that I still hold today. We only won 3 games. We lost 13. I lost more games in my rookie year than I had in my entire high school and college career combined. It was a very challenging year. One of the bright spots of that season was 1998 was also the year I became part of the St. Vincent team. That is a relationship that I have cherished since. Like Jonathan said, in 2007, 12 years ago, we cut the ribbon on the first Peyton Manning Children's Hospital. It was a special moment in my life, and it has been an incredible 12 years. That ceremony took place the day before the Colts unveiled our banner after winning Super Bowl 40. I'm honored to be a part of that team, but even more honored to be a part of the Peyton Manning Children's Hospital team. I am excited to be in Evansville today. I've had a great day. I had a great workout at Bob's gym earlier. Met quite a few people. It got pretty crowded right about 11:30. Played 9 holes at Victoria National. I've always wanted to play there, and I've got to meet a lot of good people. But I am so excited to be here today as we announce the alignment of pediatric care throughout the state, and like Dan said, the integration of our children's hospitals. As a parent myself, like Jonathan and so many others, I understand the importance of selecting a care provider for your child. You need a doctor and a care team that listen to you and truly understand the needs of your child and your family. Now, I have seen firsthand the exceptional care provided by our teams throughout the state of Indiana. And I am thrilled for this community to benefit from that care. The pediatricians, the specialists, the staff, they are committed to quality, to innovation, and successful outcomes. For me, today is groundbreaking. The addition of a second Peyton Manning Children's Hospital in Indiana will allow the team to provide life-changing medical expertise to even more families, as well as train future pediatric healthcare professionals and, most importantly, continue the healthcare system's mission to care for the poor and our most vulnerable patients. I'd like to now introduce to the podium the president of the Children's Hospital, Dr. Hossein Marandi. Thank you very much.
Thank you, Peyton. Thank you, everyone. Today truly is an outstanding day, and it's been long to get here. And I know everybody's excited that it's finally here, and I'm extremely proud. I'm extremely humbled to be in front of you and to present you Peyton Manning Children's Hospital in Evansville. So thank you for being here to join this momentous day with us. St. Vincent Evansville, as well as the Children's Center for Children, have been providing quality pediatric care to children in the tri-state area for a very long time. I want to make sure that we thank each and every one of the people that have made that possible for so many years until today, and now making sure that we welcome them to the Peyton Manning Children's Hospital name and team. So thank you for all the work that you have done. You have really created the opportunity for us to take that next step as we are today. Peyton Manning Children's Hospital with many doors. As a pediatric mother, I understand the importance of having care close to home. Children should be cared for close to home. It's difficult for the parents, difficult for the child when they have to travel. That is the culture that I wanted to bring here, and that's done in Indy, and that's what we're going to do here. Keep those children closer to here, while at the same time knowing that you always have a safety net for those high complex care needs that can be taken care of in Indianapolis, such as brain surgery, heart surgery, but everything else we would love to be able to continue to keep the kids here in this community. Through the collaboration, patients and families will receive the same quality care that they receive in Indianapolis. As Jonathan mentioned, we have taken our clinical teams and connected them together, allowing them to understand what the care pathways, guidelines, and the outcomes should be, no matter if the child is taken care of here or taken care of in Indianapolis. Peyton Manning Children's Hospital Evansville will consist of 70 beds. 40 of those beds will be our NICU, 7 will be our pediatric intensive care unit, and the rest of them will be medical surgical beds. We will have a cadre of pediatric trained hospitalists, intensivists, neonatologists, and all of them will be part of the larger Peyton Manning Children's Hospital family, living here, working here in this community. We will not stop there. We will continue with outpatient care. Comprehensive outpatient services will be offered through the newly branded Peyton Manning Children's Hospital Center for Children. Pediatric specialists are available to provide care right here in the community, limiting travel for parents and children on a regular basis, as I mentioned. Specialty services include one of the nation's premier feeding programs here. We have an outstanding behavioral health program, gastroenterology program, cardiology clinic, a new full-time neurology clinic, first here in the city of Evansville. And all of those things are going to continue to round out the care that needs to be provided here close to home. Additionally, Peyton Manning Children's Hospital specialists, such as orthopedic surgery and endocrinologists, will continue to travel here to bring that care, again, closer to home. The multidisciplinary care teams in Evansville include physicians, nurses, ancillary staff, and they're all dedicated to meet the special needs that children have, not only here in Evansville, but also the tri-state area. I'm proud to have them as a part of the Peyton Manning Children's Hospital team. Many of them are here today, so please join me in thanking them for all that they do. As Jonathan talked about earlier, there are countless people that have helped us get here today. Many days, months, and years have been worked on to get us to this place today. So there are a few people that I want to specifically mention because they've done a lot of work. One of them is Nicole Toole and Dr. Maria Del Rio Hoover, who have been instrumental in making this reality. But it's not just them. There have been so many other people that have helped us to get to this day, and I really want to thank them for their passion and for championing this process to get here today. Thank you. Let's talk about our patients and families, because I cannot leave them out. You inspire us to do more every day. and Dan wanted to repeat what he said, and I'm going to repeat that also. You inspire us to do more and better things every day. That's what we're here for. It's because of you. And I know we have some of them in the crowd here today too, and please get a chance to talk to them also and listen about the great care that they've received here closer to home. So thank you for allowing us to take care of you. Lastly, I would be amiss if I didn't thank the Evansville community. Thank you for all that you've done. Everything that you've done in the past to get us here, the present for today, and the future, because we have a very bright future, and we will not be able to do that without the help of each and every one of you. So thank you for everything that you've done. So in closing, on behalf of the Peyton Manning Children's Hospital, we are privileged to be the choice for parents, physicians, and providers in Evansville and the tri-state area. We're excited about further expanding our specialized services to the community so that children can have greater care closer. But we're not going to stop there, because I'm going to bring Dan back up here and talk about a little bit more, something else that we're going to do. So with that, Dan, thank you very much for your time.
So what an exciting announcement, what an exciting day. And as I look out to so many friends and supporters and leaders, I know what this means to this community. And I'd like to just ask, before I give you one more bit of good news, if you would join me in, again, thanking Mr. Manning and Mr. Nally and Dr. Morandi for this great announcement today. And we're not done yet. So there's one more exciting piece, and that is that today we are taking a step that's really going to advance our emergency care. And tomorrow morning, we will be opening the Peyton Manning Children's Hospital Emergency Room for Children right here in Evansville. As the area's only verified trauma center for both adults and pediatrics, this is not new to us, providing the highest quality care to our community. But this is a true advancement in emergency care that we are very excited about to assure that patients of all ages receive the best emergency care possible. So opening the emergency room for children, we're raising the bar on pediatric emergency care, and we're providing even more specialized services and space for our youngest patients. In developing the pediatric emergency room, a team of clinical professionals both from St. Vincent Evansville and from Peyton Manning Children's Hospital have been working together to create an exceptional experience both in clinical quality and in patient and family experience. The emergency room will be staffed by nurse practitioners who are specially trained in pediatrics, working closely with board-certified emergency room physicians, and have the opportunity to have pediatric hospitalist consultations 24 hours a day in the hospital. This exceptional team is well prepared to provide personal, specialized care for children with either acute, chronic, or complex illnesses. In addition, the patients treated in the emergency room will also have access to follow-up care at Peyton Manning Children's Hospital's network of pediatric subspecialists. We will have 7 private treatment rooms that will provide comfort to our patients to help reduce anxiety and wait times for children and their families. And we'll offer x-rays and lab results right inside the children pediatric ER. In just a few minutes, I'm excited that you'll get the chance to tour the space, and you'll see that this is a special place for healing with children. And I believe you're going to be just as impressed as I am at what a great space that's been created for the children here in the tri-state. We've got a dedicated team that's been working on this. I want to thank them for that. First, I would mention that we've got our ER leadership team led by Team Health and Dr. Otto Susik, who will be supervising all the medical care. And I want to thank again Dr. Maria Del Rio Hoover and also Dr. Morandi and their teams for really working hard to create this children's emergency department. This team of experts has come together to ensure that we're offering the very best emergency care in the tri-state area. I also want to extend a special thank you to our foundation, who has helped make this space possible, and a special recognition to the Ted and Claire Zemer Society. These generous donations have made the space possible, including some of the wonderful creative artwork that you're going to see from a very talented artist, Dacre Sinclair. So at this time, so the pediatric emergency room is a small space, and we're a pretty large crowd. So a few of us are going to move down to the emergency room and cut the ribbon, and then in just a few minutes, we will be able to offer you a tour so that you can go down and see that for yourself. We can't all go down there as one group because if you can appreciate, we're also operating the emergency room as we speak, and that could create a little bit of an issue. But if you'll give us just a few minutes, we'll go down, we will cut the ribbon, and then we'd love to have you come down and have a tour in just a few minutes. We do have directly in front of me some refreshments in the gift conference room. We'd love for you to stay for a couple minutes, talk with each other, really celebrate this special occasion, and then come take a tour in a few minutes. I do want to say again, thank you to each and every one of you for being here today as we celebrate a true advancement in pediatric care for our region. Thank you so much for being here.